You are watching CBC News Today. I'm Nancy Wilson. We still don't know just why Robert Sikansky died at Vancouver Airport after police used a taser on him. The electric shock could certainly not have killed him, and an autopsy found no obvious cause. One diagnosis that's being suggested is something called excited delirium. A coroner's inquest in New Brunswick blamed it for the death of a man who'd been tasered there 2 years ago. But it's a controversial conclusion. So we're asking an expert. Dr. Shree Bhalerao is Director of Medical Psychiatry at St. Michael's Hospital in Toronto and joins us now. So we've heard just in recent days this term excited delirium, I think, which is new for most Canadians. What do we know about this? What exactly is this?
I think it's new for me too, because from a medical point of view, we tend not to use the term. We do use the term delirium, and I think it's synonymous with what we call a hyperactive delirium, and that's sort of an acute onset of changes in a patient, like their consciousness and cognition.
Right.
And it's usually associated with a general medical condition that's creating this disturbance. And again, it's fluctuating. It goes up and down.
And we've heard that those people in this state, characterized as such, often display real strength. And someone has said it's almost like having an overdose of adrenaline. Does that seem like a fair characterization?
I mean, it is. It's fair if you're intoxicated or if you're on a substance. If you look at some of the case reports, there tend to be on stimulants or cocaine of some sort. But generally in the medical setting, it's safe to say that there's a disturbance in kind of a multitude of neurotransmitters. They can look revved up or they can look slowed down. But the key element is the confusional state.
And in this state, what do we know appear to be the warning signs? We've heard of sweating and displays of strength. What else do we know?
I mean, besides all of those other elements, again, I mean, you can have paranoia. Patients will be disoriented. They'll be writhing in bed. They'll be doing non-purposeful behavior. So things that make them look much different than someone else.
So in this state, if there is a taser, if you're on the receiving end of a taser, how might your current agitated state be affected by being subjected to the electrical current of a taser?
The right answer to that, it's unpredictable. But what we tend to do, at least in the medical setting, is kind of weigh the risk factors. Like if you have a patient that's had a previous delirium, has had electrolyte changes, has had a lot of medical conditions, and then you subject them to another stressor, like a taser,
right.
I think the right answer would be, it's probably not going to help. And I think that's a key piece that I think should have been taken into account when you're using this. I think you need to know that piece.
Okay, so I know you've looked at the videotape in the case of Mr. Sikansky, and did there seem to be the exhibits of certain symptoms that might be excited delirium? Of course, we don't know. When you watch the tape, you can't really glean that much information. But were there some of the symptoms there that might have been warning signs that ought to have been flagged by police?
I can't say, but what I can say is that you could borrow a piece and say, yes, there was some behavioral disturbance.
Right.
But again, you can have a behavioral disturbance if you happen to be upset about something. There's the language barrier. There's the inability to get what he wants in a situation that apparently what I had heard, he had waited for 6 hours and he was unable to communicate with anyone in regards to doing anything further about his situation.
Just going back to this term excited delirium, which isn't really, it's not accepted as an official condition within this sort of established medical community. Why then would this have, you know, one particular coroner did list it as cause of death, which clearly surprises you and others. Is it now achieving a kind of legitimacy, or is it still surprising that it might be listed as cause of death?
Well, it hasn't made its way to the hospital.
Right.
It's still, I guess you could call it kind of the pop culture comment about confusional states. But I also thought maybe it's something that the police might describe or use for convenient purposes to describe patients that might be in a confusional state.
And before we leave the whole subject of tasers, are there other medical conditions that would put an individual at risk if they were tasered, whether or not it's a heart condition, if you have a pacemaker? I mean, again, are those certain things that certainly your reaction is going to be infinitely more acute than just being subjected to the taser?
For sure. I mean, again, I'm not the specialist in tasers and their effects, but I am aware that any kind of perturbation of the system with electricity is obviously going to cause a problem if you have any ongoing other medical conditions. And I think the best example is if we clear patients for anesthesia or electroconvulsive therapy of some sort, we always get them medically cleared in regards to cardiac problems, neurological problems, head injuries, and so on. So they're always medically cleared.
Very interesting, Dr. Bhalerao. Good to talk to you. Thanks so much for being with us today.
Thank you.